Hi, a very good evening, all of you. So, this is our second live session of 2024. So, in the previous live session, the first live session of 2024, we tried certain areas around NEET MDS preparation strategies. And we tried answering some of your questions in the process. And we have elaborately discussed on various strategies, like what you can do, the kind of schedule that you can follow, and various other relevant tips which we keep on highlighting using our YouTube channel. And in this second video, as I said, will come up last time, if you remember, I mentioned that we'll be coming up with subject discussions as well. And textbook discussion is something which is my favorite. And keeping that in mind, we shall conduct this session. So today's topic will be hot tooth. And for this, we'll be reviewing Grossman 14th edition. The page number is around 132 or something, the latest edition, I reckon, and you can check it out in the process. But before we go with textbook review, so what is the objective of this session? So the objective of this session is to discuss the concept of the topic hot tooth, like what's the mechanism, like why do we come across, like first and foremost, what is hot tooth, and then why do we come across this hot tooth, the mechanisms, various proposed mechanisms leading to hot tooth syndrome or hot tooth, and how to manage it. In fact, if you see, if you have ever come across this topic, it is categorized as an emergency, endodontic emergency, right? So before we get into all these details, I just have a request to all of you, those who are attending this live session. I want you guys to have your own notes and pen so that you can make a note of certain important points which we'll highlight in the process of this textbook review. And once the session is done, after we conclude this live session, we will use another platform, that is YouTube's community platform, in order to post multiple choice questions. Previously, we used to do it in our Telegram updates group. You can access the link here, or in our study group, right? But we'll use YouTube's community page. So YouTube has a community page. You can check it out, where I regularly post lot many updates. So I thought, like, why can't I post multiple choice questions there as well, where you can select answers and then test your knowledge accordingly. So what we'll do is we'll discuss about hot tooth in this video for maximum 20-25 minutes, not more than that. And because studies have shown that the concentration potential is peak for 20-25 minutes maximum, so we'll try to utilize the first 20-25 minutes for that. And once the session ends, I'll start posting some MCQs, maybe hardly maximum 5 multiple choice questions from this topic, and we'll see how it goes. Okay, so this is the idea which I have in mind, and we shall start. So before we start, like, if you have a textbook with you, that would be great. You can simultaneously open the hard copy of the textbook, the latest edition, or any edition of Grossman that you have, or Engel or Cohen, it doesn't matter. Open the topic hot tooth. And before I read, so the idea behind textbook discussion is to go through the information. In fact, if you remember last session, I detailed you about the importance of standard textbook references. In order to encourage that, we are doing these textbook reviews. So what we'll do is we'll go through the information that's presented in the textbook and then analyze the given information and highlight certain important points in the process. And before we do that, I'll try to present you an overview of this topic, and then we'll jump into the textbook review, right? I hope the audio is fine. And yeah, you have any questions or you have any queries, you can just use the chat box. Okay, right. So first and foremost, what is this hot tooth? So hot tooth, it has nothing to do with, in fact, in one of the articles I found it was funny. They're talking about the appearance of tooth. They're talking about the exothermic reactions. So hot tooth has nothing to do with these things. Hot tooth doesn't mean the tooth is attractive. Like the term which is nowadays used by Gen Z and Alpha, including millennials, right? Hot people, right? It has nothing to do with the attractiveness. And hot tooth has nothing to do with the temperature of the tooth, right? We should be first clear with that. So what is hot tooth? As the term itself indicates, it has something to do with the symptoms. Hotness, if you see, the symptoms of inflammation or the signs of inflammation, we have these cardinal signs, right? Ruber, Keller, tumor, dollar, functional is your loss of function. So, maybe keeping that in mind, they might have termed this as hot tooth. So, hot tooth is a diagnostic term which is used for tooth or teeth which is difficult to anesthetize, especially when you're proceeding with root canal treatment. So there is a case of irreversible pulpitis, and you give local anesthesia, you give INB block or any block per se, and then you try to initiate root canal treatment, access opening, then it's not possible because these teeth are kind of resistant to the action of conventional local anesthetic agents. So any tooth which is symptomatic and is not responding to local anesthetics, and there is moderate to severe pain when you're performing this access opening in spite of giving a block, so that tooth can be considered as a hot tooth. So what could be the reason for this hot tooth? So there are multiple mechanisms that have been proposed in various articles, various textbooks, but Grossman highlights the presence of tetrodotoxin resistant sodium channels, a special class of sodium channels which are present on C fibers. It's because of more expression of these kind of sodium channels which are resistant to action of lidocaine, right? The nerve cells or the C fibers are getting more sensitive, right? And there is something called as hyperalgesia. So this is a mechanism they talk about. We'll look into those things in detail a bit later. And when it comes to management, see, hot tooth is very much considered as an emergency. In fact, when you look into the classification of endodontic emergencies, they have categorized emergencies based on the time of their occurrence in respect to the treatment. If the emergencies occur before initiating treatment, pre-operative, or during treatment like hot tooth, during or perioperative, or after treatment of root canal, if there is an emergency, then post-operative. So hot tooth comes under dental emergency, endodontic emergency, and it is categorized as intraoperative or an emergency which happens during the procedure, right? And when it comes to management, this is very much important because in a clinical perspective, even as an endodontist, I can tell you, like, when you come across a hot tooth, you are under assumption that you're given a block. Let's take, for example, lower first molar. You go with INB, inferior alveolar nerve block, where the failure rate is around 40 to 80% depending on various studies. So you go with block, and then you are confident that the block is going to work because the patient symptomatically, he says like there is ipsilateral numbness and he cannot have sensations of soft tissue, so you go ahead confidently. But as you keep on drilling in an attempt to create an access, right, towards root canal treatment, patient suddenly jumps out with pain. And it's not only stressful, of course it is painful and stressful for the patient, it also makes dentist or the endodontist more apprehensive. So managing hot tooth is very much important from a clinical perspective or clinical point of view. So how to manage, they talk about different supplemental injection techniques, they talk about buffering the local anesthesia and various other techniques which will go in detail. So this is the overview of hot tooth, the mechanism of management. So as I said, we'll have a textbook review, and for which I will be referring Grossman 14th edition, page number 132, I guess. I mean, if anyone is lucky to have a hard copy, you're definitely lucky because you can use a marker pen and highlight various important points if possible. Or if you have a notes with you, you can just make a note of certain points which we'll highlight in the process, okay? The objective here is once you have notes, no matter what the topic is, no matter how many MCQs you're practicing, once you have a customized notes, just before you give your final exam, especially last few days, last week, last 2 weeks, this notes is going to enhance your confidence and it will save your time. Because I keep reminding this, like notes preparation, customized notes is going to enhance your confidence because the information that's present over there is highly customized to suit your needs, right? To suit your understanding of the topic, and it helps you save your time. Number two, because in a way, you're not going through the entire topic. You need not go through the entire topic, just the key points, which will give you an overall idea of what the topic is all about, right? So notes preparation is something which we keep highlighting even till date. I have this habit of maintaining notes. No matter what the topic is, I have the habit of maintaining notes. So notes, in a way, not soft copy notes. I mean, not typing, not at all. I'll tell you this. If you put it on paper, physical manner, right? If you write it down, it will be better registered in your memory. Science has proven that. Experience tells you the same. So whenever possible, use a hard copy, right? Have a physical notes, have a marker with you, have a pen with you. Okay, fine. So first we'll go to that Grossman's, as I said, 14th edition. As I said, in the process, I keep highlighting certain points. You can make a note of it. So what is hot tooth? Definition. So as per Grossman, this is the latest edition as far as I know, 14th edition. They say a tooth that is difficult to anesthetize is hot tooth. That is according to Grossman. And this is most commonly encountered in a mandibular first molar tooth, wherein after the anesthetic block, the patient may describe profound numbness of ipsilateral or the same side lip or tongue, but still experiences acute pain during access opening procedure, which is really painful for the physician or for the dentist as well. And if you observe in this particular instance, they have mentioned something about the incidence or the probability where you can get hot tooth. See, as I mentioned, this is most commonly encountered in a mandibular first molar tooth. I want you all to underline that point or make a note of that point. So hot tooth frequency is mostly seen, the incidence of hot tooth is mostly in and around the mandibular molar region. So as I said, as per studies, this is most commonly encountered in a mandibular first molar tooth. Please make a note of this point, the first point that I want you guys to highlight. Now, coming to the counter question, I said just now that mandibular first molar is the most commonly encountered or affected tooth, wherein we come across hot tooth, right? So why is it the case? And remember, hot tooth is seen in situations where there is irreversible pulpitis, where you're planning for root canal treatment. So all teeth can be affected by this. We can find irreversible pulpitis in all the teeth, right? Why not? But why hot tooth is more common in mandibular first molar? So if anyone has an idea, you can just let me know, because I hate answering questions directly. If you can answer by yourself or if you can do some research. So let's leave that question unanswered. I'm not going to answer that question. We'll take up that question again next session, before the next session. But I want you guys to probe into it. Like, why do we commonly come across hot tooth in mandibular first molar? Okay. So this is some brief intro that they have presented in Grossman. In fact, they have given very limited information in Grossman when it comes to hot tooth. And there is some additional information which I can share in the form of a soft copy in our updates group. So there is one article which neatly outlines various other causes, management, mechanisms, etc. in detail. I'll share that article in the updates group, and you can find the updates group link, the Telegram PTBD Academy's updates group link in the chat box here. Okay. So when it comes to mechanism, so what is the mechanism that leads to this hot tooth? As I mentioned in the introduction, in brief introduction, it has something to do with special class of these sodium channels on C fibers, right? So as you can see, there is a special class of sodium channels on C fibers known as tetrodotoxin resistant sodium channels. So you can just underline this particular point, tetrodotoxin resistant sodium channels. So the gene expression changes from tetrodotoxin sensitive to tetrodotoxin resistant sodium channels during inflammation under the influence of prostaglandins. That's a mechanism which is not mentioned here, it's mentioned elsewhere. But because of inflammation, because of prostaglandins, especially PGE2, as is cited in one of the articles, there is more expression of tetrodotoxin resistant sodium channels. So these are resistant, in fact, they are 5 times more resistant to the action of lidocaine than their counterparts, tetrodotoxin sensitive sodium channels. So this is another important point. So as you can see in the mechanism, there is a special class of sodium channels on C fibers known as tetrodotoxin resistant sodium channels. The expression shifts from tetrodotoxin sensitive to resistant during neuroinflammatory reactions under the influence of prostaglandin and creating inflammation. So these tetrodotoxin resistant sodium channels play a role in sensitizing C fibers and creating inflammatory hyperalgesia. So you can just make a note of this particular point, right? Tetrodotoxin resistant sodium channels are implicated as one of the mechanisms for or towards hot tooth. You can just make a note of this one particular point. That's a take home message from this particular para. And then if you move on, one of the clinically significant characteristics of these sodium channels, the tetrodotoxin resistant sodium channels, one of the clinically significant characteristics is that they are relatively resistant to lidocaine. In fact, these channels are 5 times more resistant to anesthetic than tetrodotoxin sensitive channels. Third important point, right? So you can just make a note of this as well. So these are almost 5 times more resistant to the action of anesthetic, and that's the reason why we see failure of anesthesia, right? And then if you continue, hot tooth, mind it has nothing to do with appearance, it has nothing to do with the temperature of the tooth. Hot tooth may be explained by the fact that tetrodotoxin resistant sodium channels have not been adequately blocked by anesthetic. That's understood. Now coming to management, how do we manage this? In fact, they have clearly outlined supplemental injection techniques and buffering in Grossman, but also we can go with pre-medication, which is nowhere mentioned here, and acupuncture as mentioned in some of the articles, and new and latest treatment protocols like cryotherapy, which is very interesting to know. So we'll share all that information in the form of article, a soft copy in our updates group as mentioned previously. So when it comes to management, so as you can see, the first one they talk about is buccal infiltration. In fact, during my post-graduation, I tried intraligamentary, which really worked to a greater extent. This mind you, we're talking about supplemental injection techniques, which means a hot tooth has been diagnosed, the block has already been given, INB or whatever. Let's suppose you're going with mandibular first molar. INB block has already been given, and in spite of giving that, there is still symptoms, right, which are exceeding from the tooth. So we go with supplemental injection techniques like buccal infiltration, intraligamentary, intrapulpal, intraosseous, etc. Right? So we'll go into those details briefly as given in the textbook. So the first one they're talking about is supplementing an inferior nerve block with 4% urticine in 1:1 lakh epinephrine, buccal infiltration, and a volume of 0.9 to 1.2 ml at the apex of tooth to be treated is one of the most effective supplemental injection techniques. You just make a note of this point, that buccal infiltration using 4% articaine, 1:1 lakh epinephrine concentration, it is considered to be one of the most effective supplemental injection techniques. Just make a note of that. And then the second one they're talking about is buffering. Buffering means alkalizing. Trying to maintain that acid-base balance using sodium bicarbonate. So here they talk about alkalizing. So buffering the dental local anesthetic solution immediately before its administration with a stabilized sodium bicarbonate solution has been found to make the onset of anesthesia much quicker in hot tooth. So we're trying to improve or increase the onset of anesthesia by buffering the local anesthetic solution. But the question here is, how does it work? If you remember, long back, several years ago, we have done a live session on local anesthesia in which I have mentioned, but even in Malamed, it's clearly mentioned, LA book Malamed. There is something called as base form for an anesthetic solution, and there is something called as ionized form. We need base form in order to have better permeability into the tissues. Lipid solubility is great, but we need ionized form to act on that particular nerve. So by buffering the local anesthetic solution, we're trying to increase one form of local anesthetic solution. I've given you the hint, so try finding out. So why buffering improves the onset of local anesthesia? It has something to do with the base form or ionized form of local anesthesia. One of the forms is available more. As a result, it is penetrating deeper into the nerve tissues, into the nerve fibers, and then the other form takes over and has its anesthetic effect, right? So buffering is mentioned as another mechanism. Okay. Hi Vegas. And the third one they talk about is other supplemental injection techniques like intraligamentary. So intraligamentary injections, also they say they're helpful to ensure profound local anesthesia. For intraligamentary injection, a volume of a very little amount, because the tissue there, ligament is so minimum that you cannot deposit more amount. So if you see, in case of buccal infiltration, we are going with almost 1 ml of solution, depositing 1 ml of solution, as mentioned here, 0.9 to 1.2 ml. But in case of intraligamentary, we're just depositing 0.2 ml, a very minimal amount, not more than that. We can't do more than that. I mean, if you had ever tried intraligamentary, it's very challenging. Supplemental intraligamentary injections are also helpful to ensure profound local anesthesia. And for intraligamentary injection, a volume of 0.2 ml of LA is deposited slowly using a short gauge needle, 27 gauge needle. The bevel of the needle is placed in the periodontal space on the mesial aspect of the first molar, either mesiobuccal or mesiolingual, with the bevel facing the root of the tooth, and the needle is advanced into PDL space until firm resistance is encountered. It's about the technique. If you are planning to actually give an intraligamentary injection, this clinical information is very much helpful. The direction of the bevel is also very important. Mark my words. And finally, they talk about intrapulpal injection. When I say finally, the topic is so big, but here they have very much concised it in the latest edition of Grossman. So anyways, they talk about intrapulpal injection. Finally, the direct injection into the body of the exposed pulp can be done only if the exposure of pulp is large enough to admit a hypodermic needle. However, this is a very painful injection, and they ask us to refer to chapter 10 for other supplemental anesthetic techniques. And when you refer, you'll find intraosseous, right, other injection techniques as well. And before we conclude this textbook review, look into the clinical note that's mentioned here. 2 important points, you can make a note of it. The first one is the incidence of a hot tooth is most commonly encountered in mandibular first molar. So that's the question I'm posing to you as well. Why is it? I mean, mostly we stop with this information. We just stop with the fact that, okay, hot tooth is seen in first molar, fantastic, great, but why? In fact, in life, why is one of the profound questions you can ever pose. It can be relationships, it can be professional growth, it can be anything that you do on a daily basis, or for that matter, right now we are doing this live session. Why this live session? So why? And it gives a lot of clarity in life, and it enhances your perspective in the process. So why the incidence of hot tooth is most commonly encountered in mandibular first molars? We have seen previously that it is mandibular first molars, but why? Okay, try finding out, try exploring. We'll discuss that in the next session. And before that, it's better if you find out. And the second point they mention in clinical note is the inferior ulnar nerve block has the highest failure rate in achieving pulpal anesthesia. In fact, in some studies, they haven't mentioned here, but in some articles, in some PubMed indexed articles or EBSCO indexed articles, they are mentioning the failure rate to be in the range of 40 to 80%, which means the chances of INB failure are very high. That's the reason why we're facing all these issues, right? And coupled with this, you should also remember that we have, in the process, tried to highlight about tetrodotoxin resistant sodium channels, special class of sodium channels on C fibers, so on and so forth. But along with that, there are other factors which play a role in the mechanism of hot tooth. Inflammation plays a major role. Activation of nociceptors, as mentioned in one of the articles which I'll share later. And there are so many other factors they mention. So what we'll do is, I'll post that article in the updates group, okay, for your review. You can go through it. And then once we'll conclude the session in another 5-10 minutes, and then we'll start posting questions, MCQs, where you can answer MCQs on our community page, our YouTube channel, which has around 98k subscribers. We have a lot of participation. I encourage you guys to involve in the participation, involve in the discussion, and participate to the best of your ability, right? So this is in brief about hot tooth, the textbook review. From next time onwards, since you understood how we are planning these reviews and stuff, how we are planning these textbook reviews and discussions, we have this habit of announcing the session at least a couple of days prior, at least 1 or 2 days session prior, 1 or 2 days prior. So next time, before we announce the session, I want you guys to check out our update and then have a hard copy of the textbook if possible with you, along with your notes, marker, and pen. So once you are really involved in the process, mark my words, those who have followed this session diligently, sincerely, dedicatedly, you will never ever forget about hot tooth. All you need is a brush up of memory. So just before exam, imagine that you're just going through the key points. Like hot tooth means a tooth which is difficult to anesthetize because of iron B block failure. Mandibular first molar is commonly involved. Tetrodotoxin resistant sodium channels are implicated as one of the mechanisms behind this hot tooth. And there are many supplemental injection techniques, of which they're talking about buccal infiltration to be most effective. And also they're talking about buffering of the local anesthesia. They're talking about intraligamentary injection, intrapulpal injection. So just an overview. It hardly takes 5 minutes for you to complete this entire topic. Now, right now we spent around 20-25 minutes. But when you have your notes, you'll hardly spend 5 minutes next time to revise this entire topic. That's the beauty of maintaining notes. Okay, so two things which we root for from our academy is follow standard textbooks for reference purpose and have your customized notes, which is the game changer, right? So with this, let me conclude my version of textbook discussion. I hope the session is helpful. In the coming days, maybe we'll look for more opportunities to have a board. Previously, we used to do that, a board with a marker and then trying to explain things on board. We'll try to incorporate them slowly, step by step. Okay? And your feedback is always welcome. And you have any questions or you need any clarifications, you can just use the chat box. So who is this? Vegas? Hi Vegas. Hello. A very good evening. So shall we conclude this session or do you guys want me to? If you want me to say something, then you should ask something, right? It's 8:50. Okay, so no questions, then we will conclude this session. Okay, so keep a tab on the updates group. The link has been posted here in the chat box, and also keep a tab on the community page of YouTube where you will get questions very soon. Right. Yeah. Good night, guys. Take care.